At first, giving someone a medicinal drug via injection may seem quite daunting, especially if their life depended on it. However, as long as you remain calm and remember your training, you should be fine. Because you're dealing with a needle, you need to be aware and be careful of any needle stick injuries. This can range from grazing your finger with the tip of the needle to actually injecting yourself with some of the drug by accident. Again, there will be a higher chance of this happening if you do not remain calm. One of the more common brand names for naloxone by pre-dosed injection is Pronoxad. So first of all, you want to break the seals of the naloxone box so you can open it. Inside the box should be one syringe of naloxone along with 2 needles. There are 2 needles in case one is damaged or it gets contaminated before you can give the injection. Once unboxed, twist the grey top of the syringe to unscrew it, ready to attach the needle. Then take the paper off the back of the needle packaging and carefully take it out. At this point, the needle sheath should still be in place. This is because it's much easier to attach the needle and it reduces the risk of needle stick injuries. Next, you must carefully screw the blue needle onto the syringe and then carefully remove the plastic sheath, exposing the needle. At this point, everything is ready to inject the person with a dose. On the syringe, you should see markers labeling how big each dose should be, and this equates to 0.4 milliliters. To start with, you want to inject them with only 1 dose. This injection is to be carried out intramuscularly, which means you're injecting the medicine directly into the muscle. This helps disperse the drug quickly throughout their body, as muscles have a rich blood supply compared with other tissues in the body. To make sure that you're injecting directly into the muscle, there are 2 sites on a person that you can inject into: the upper outer arm and the upper outer leg. Because the arm is smaller, the correct site can be harder to find, especially for people without a lot of anatomical knowledge. This means that a lot of people prefer to inject into the upper outer thigh. A helpful thing with this type of injection is you can go directly through clothing if necessary. However, zips and seams should be avoided. Also, be aware of anything that may be in the person's pockets, and remember that with opioid overdose, there may be contaminated needles. When you're ready, you can push the needle into the leg at a 90-degree angle. This ensures that the drug will get deep into the muscle. Once the needle is all the way in, you can then push down on the plunger until you have administered 1 dose of the drug. It's important that you do not give more than 1 indicated dose. After the drug has been administered, you can smoothly pull the syringe and needle out of the site and put it directly back into the case. Again, at this point, the needle will not only be exposed, but you have contaminated it. Therefore, you should not replace the sheath, as this is a very common time for needle stick injuries to occur. So by placing the needle directly back in the box, not only do you know exactly where it is, you also avoid harming yourself. Once the needle and syringe are back in their box, make a note of the exact time the first dose was given. This will be paramount for the paramedics and doctors. This can be done by any means, including making a note on your phone, a piece of paper, or even using a marker pen to write the time on the patient. The naloxone will start to work in 2 to 3 minutes depending on the level of overdose. 1 dose may not always be enough. If after 2 to 3 minutes there is no sign of them getting better, give them another dose through the same technique. You can use the same needle as long as it's for the same person. After giving the 2nd dose, hopefully the EMS will have arrived and they can take over. Whilst you're waiting for the naloxone to work, putting them in a recovery position is a great way to make sure they don't choke on their tongue, as previously discussed. It also allows any fluid such as vomit to not block their airway. Once they are in the recovery position, you should stay with them unless you have to go directly to call the EMS. Ideally, someone else will be doing this. However, as long as they're in a recovery position, they should be okay if you have to leave them for a few seconds.